Hyderabad, and of course in different parts of the country. And we are a volunteer driven organization. So we have 6 regular programs that we work on, and all the 6 programs are focused on 7 United Nations Sustainable Developmental Goals. To know more about our organization and our work, you can please log on to our website, that is www.youngistaanfoundation.org, and you can check about our work and the regular programs that we do. Apart from that, we also support with volunteers during times like disaster relief. So during COVID-19 and of course during Hyderabad floods, our team was actively participating on ground, supplying the relief materials to families affected by pandemic and of course by the Hyderabad floods. And we were doing it along with the Telangana State Police, the GHMC, and the other government officials, of course, also with other civil society organizations who are relentlessly working on ground. So that's what we do. And of course, I cannot definitely tell about what Youngistaan does in 5 to 10 minutes. So I would request you all to please check about our work on our social media platforms, on Facebook and on our Instagram. So today we are hosting this session for all of you. I would request Rinki to take over and introduce more about the event and the purpose behind it. Thank you. Rinki, you're on mute. Can you unmute yourself? You're muted again.
I guess
Yeah.
someone's okay. Yeah. So the whole purpose of this event was creating an awareness surrounding breast cancer, and awareness about breast cancer is incredibly important as early detection. So often through screening, we are able to catch the disease when it's most treatable. But breast cancer is the most common cancer in women, except for skin cancer. So just some stats. A total of 7,066 women aged between 15 to 70 years showed varied levels of risk factors such as family history, reproductive history, and obesity. So, and in India, more than 50% of breast cancer patients are suffering from stage 3 and stage 4, where the chances of survival are extremely low. So we at Youngistaan are doing our bit to create an awareness through this workshop. And I guess I welcome you all, and hopefully you all will have a good session throughout the. Yeah, I guess we can now we can have Lavanya. Lavanya, over to you. Lavanya, you're on mute. Lavanya.
Hi, Rinki. So we'll have Rinki joining our call in next 5 minutes. So meanwhile, if you could hear a story from Neeti, it will be
Sure.
great.
Yeah.
Lavanya, we can't hear you. There are still some connectivity issues, Lavanya. We can't hear you.
Okay, I guess there are some connectivity issues. So,
Hello.
yeah, Lavanya, we're able to hear you now.
Hello everyone. I'm so sorry there was some audio issue with my headset. So thank you so much, Rinky, for giving brief about today's event and all. Yeah, I'm going to introduce Neeti. So here we have Neeti today. Neet, meet Neeti Lekha Chabra from Delhi, a young breast cancer survivor who has vowed to save every life she can by spreading awareness about the illness and put out a challenge on social media called Unhook the Bra to draw people's attention to many realities. She started a non-profit organization called S2 Life that promotes breast cancer awareness, screening, and patient support, financial, emotional, and rehabilitation. Now, I would request Miss Neeti to talk about her journey.
Hi everyone, good morning. Hope you're doing well and hope the audio and video are clear. If someone can quickly just
Yes, it is.
confirm. All
It
right,
is
great.
clear.
Okay, so as introduced, my name is Neeti and I'm a breast cancer winner, and that is how I have been invited today to be a part of this wonderful event. Let me just share a little about how did my diagnosis happen, and my story thereafter. So my diagnosis happened back in 2012 when I was 31 years old. I think a pretty, relatively young age to have breast cancer. I am so happy that there's so many of you who are attending this breast cancer seminar, awareness session today. But honestly, had I been asked back then, I would have said no to attending any such thing because, there is no family history. And I somehow always used to think that cancer is a very filmy bimari, like something that they only show in the movies. If they have to show somebody dying in a rouse pity, it's cancer. Or if the doctor tells anybody, that, oh, you don't have much time, that it's going to be cancer. So that is the kind of image that I had, and I had never done a self breast exam. I had never paid attention to any kind of screening. But I was lucky that the lump that I had was on the surface of the breast. And I initially thought that it was related to menses, since during periods many of us feel cysts or heaviness or pain. And I slept over it for around 2 months, thinking, that it will go away. But of course it didn't. And after the 2 month period got over, I suddenly again remember that, oh, the lump is still there. And I got very tense because I was very, very sure that there's something extremely wrong. I was so naive. I didn't know what kind of a doctor to go to. I didn't know that somebody as a breast surgeon even existed. So I Googled to see what kind of doctor should you go to. So I found this doctor, and I got an appointment for a week later. And I remember in that 1 week, so my sister is in US, and on a call I discussed about, hair fall, breast removal, like whatever I could think related to breast cancer. Though I was wise enough not to go on Google and find out because, I am a carefree person by nature, and I did not want any added, anxiety and worries because, even if you Google about Croson, you will not be able to have it. So I kept away from Google, thankfully. Anyways, me and my husband went for the first round of investigation, which was an ultrasound. We got that done, and the report said that the lump was benign, which means non-cancerous. So obviously we were ecstatic. I remember I shouted on top of my voice, literally, that yay, I don't have cancer. And we, celebrated the whole day, eating out, shopping, and doing fun. But luckily for us, again, the doctor said that since it's a breast lump, let's not take any chances and get an FNAC done, which is a fine needle aspiration test. So we got the test done, and we forgot about it. So professionally, I am a professor, and I used to teach postgraduate students. So I was at my institute. I was into a full-time job at that time when I got a call from the FNAC center asking me to come and collect the report with my husband. So that obviously rang on all the bells, when you're being called by your, by the FNEC center, first of all, and then you're being asked to come with your husband. So he came to pick me up at my institute, and then we were going, to the FNEC center. And while I was pretty sure of what we were about to hear there. My husband kept on telling me that how he was wishing, that the sample was taken wrong, how they were calling us, to take a sample again. We reached there and we were told that I had cancer. And like I said, that on my way to the FNEC center, I had in my mind, already known what it is going to be. My husband was still wishing for something else. So the doctor actually asked me to take care of him. And after that, we started from the FNEC center to my parents' place to break the news to them. And also to discuss, that what should be done now, since, we already know that it was cancer. And on my way to the FNEC center to my parents' place, the only worry that I had on my mind was, and this is what I kept telling my husband, how am I going to tell my parents that their child has cancer? I think that you yourself knowing, that you've been diagnosed with cancer is easier to digest than for a parent to know that the child has cancer. So that was the only worry on my mind. Anyways, we reached there and I told everybody about the diagnosis. And I was the one who was literally hugging everyone, consoling everybody that don't worry, it will be fine. It is just a phase. And that is the thought process that I actually had, even before knowing the stage or other, technicalities around it. I had a very strong faith that this is only a phase and that I'm going to come out of it as a winner. I did not let my mind wander towards, questions like how much time do I have? Will I be able to live or anything? And I told everybody around me to stay in the same positive mode and not to go into ifs and buts and not to think about the future. So the treatment began after a number of other investigations. As a part of the treatment, I underwent mastectomy, which means that one side of the breast was removed, followed by chemotherapy, and then hormonal treatment that got over in December 2018. So one thing that, while of course, this is an awareness session and we'll have the doctor talk about it. But since I am a survivor, this is just to tell all of you that every breast cancer surgery doesn't lead to losing a breast, because that is one fear because of which I have seen a lot of ladies not, getting their treatment done on time or not getting their screenings done. Early stage breast cancers mostly, will lead to a conservative surgery wherein only a small part of, is taken out for the lump and rest of the breast remains intact. So nothing to be too scared of there. And, during my treatment or diagnosis, I never asked God, why me? Because I think that you can never find an answer to that. Like in my case, there was no high risk factor. I got married at the right time. I had my son at the right time. I breastfed him. There's no family history, but I still had it because it's just that anyone can have it. It's not only people with high risk factors. But me and my husband would always discuss that if this has happened, there has to be some learning out of it, because such a big experience will not come to your life, without you having to learn something out of it. And of course, a lot of learnings in terms of, taking better care of ourselves, knowing the importance of life, much more. Knowing the importance of every second, rather, it's become so easier for me to make choices now because prioritization is so easy, because I know what is really and truly important for me, and that is based on inner peace. So whatever gives me inner peace, becomes the reality for me. I also got a bigger purpose of my life in terms of Yes to Life as introduced. So I'm not going into details about it. Anybody who wants to check out our work can check it on the website. It is www.yestolife.in, 2 being a numeric 2. The only thing, as a message before, signing off, I want to share with everybody is that cancer is not as scary as